Good morning, everyone, to the Wednesday, December 22nd media briefing by the Windsor-Essex County Health Unit. We'll get started with general introductions from our CEO, Nicole Dupree.
Good morning, everyone, and thank you for joining us. I'm happy to be joined this morning by Dr. Wasim Saad, Dr. Wasim Saad, the Chief of Staff from the Windsor Regional Hospital, Dr. Shankar Nesathury, our Acting Medical Officer of Health, and Dr. Vikesh Miraj, who is the current president of the Essex County Medical Society. So I'll be shortly turning it over to these gentlemen. But first, we just wanted to remind everyone that, the holidays are upcoming. I'm sure you need no reminder, but definitely, to continue that message to, host your holidays as safely as possible. Remember all of those public health measures, including screening, washing your hands, staying home if you're sick, and hosting virtual gatherings and celebrations as much as possible. As well, certainly, we don't want to forget to tell everyone that, again, 18 and over, everyone is eligible now for their booster dose. Certainly, we are adding additional appointments daily in partnership with our hospitals and healthcare partners across the region, including pharmacies. So check regularly our website for booking. You can also call our booking line, and we just want to continue to share that message to, book and take advantage of the first appointment that's available to you, and have a safe holiday. I'll now start with turning it over to Dr. Wasim Saad, and thank you, Dr. Saad, for joining us this morning.
Thank you, Nicole. I'm here really to mark a very important anniversary and a milestone in the pandemic fight that we've had here in Windsor-Essex. This week marks the 1-year anniversary of the first vaccine that went into an arm of a Windsor-Essex resident. As we all know, that was a very momentous occasion. It was something that we were all anticipating very much, and it ushered in a new way to fight this pandemic and really changed the course of how we are managing the pandemic, what ended up happening with hospital resources and who got admitted to the hospital, and the ICU dramatically changed after our massive vaccination efforts. And I do think that when we're going through something as traumatic, obviously, as a worldwide pandemic and how we deal with things locally, I think it is important to mark these milestones and these anniversaries so that it can remind us where we were a year ago and where we are now. I get a lot of questions about, are we just going through things the exact same way and nothing's really changed? And I can tell you unequivocally that we are in a much better place now than we were previously. But the one thing that I can say is probably worse off than a year ago when we started this vaccination campaign is the status of our healthcare and our healthcare resources. That's the one thing where I think we're strained. Everyone that works in the hospital and works in healthcare has been pushed to the limits throughout the entire year. It's great that we have vaccines. It's great that we have all the public health measures, the masking, the distancing, and everything that's trying to prevent the spread of this virus, and we are in a much better place when it comes to the pandemic. But the one place where I think we are suffering that we need to recognize is our healthcare resources. So be mindful of that. But I do want to continue to highlight those successes that we've had moving forward, and we need to be cognizant of that as well. Thank you, Nicole.
Okay, Dr. Nesathury.
So thank you again, and I'm delighted that Dr. Miraj and Dr. Saad and Nicole were able to join in this dialogue today. One of the things I think is important to acknowledge at this point of the pandemic is that the mRNA vaccines are interchangeable. At the current time, there's a relative scarcity of the Pfizer product, but with more than sufficient stock of the Moderna product. When one is going for their booster injection, if you're over 30, you will be offered the Moderna injection. If you're under 30, there'll be the Pfizer product. It's not unusual in public health practice and clinical practice to have different manufacturers, products being used for vaccination, and it's happened in the past, and it's likely to happen in the future. The most important thing is to get your vaccination. We know that people that are vaccinated are less likely to get sick, they're less likely to get infected, they're less likely to transmit the illness to other people, And if you do get infected and you're vaccinated, you're unlikely to be hospitalized or die. And that helps not only you, the person getting vaccinated, but it also helps the broader society and culture and community, because it preserves hospital resources for other people, including people of other diseases, which perhaps during the pandemic we have not addressed as we might have in the past. So we encourage people to get vaccinated, and we also encourage the community to recognize that getting one mRNA vaccine or another, they're equally acceptable approaches to vaccination. So thanks, Nicole. Perhaps Dr. Mirage can comment as well.
Good morning. So I am also here to support and drive home the message with respect to the ongoing healthcare measures and the manner in which we attempt to fight and mitigate the effects of the pandemic. We understand that it's been a long pandemic. We understand that there's, pandemic fatigue, but now more than ever, it is important to follow public health guidelines. It is important for patients to go out and get their boosters as soon as possible. And it is also important to address vaccine hesitancy on an ongoing basis. I believe there's more than 50,000 patients in Windsor-Essex who have not been vaccinated. And, it is my firm belief and the belief of the physicians in the community that this should be an ongoing conversation. I think that it's important for everyone to, pause and take a deep breath and step back and to continue to have these conversations in a calm, respectful, non-judgmental manner. And as expected, and this is also borne out by research, your family physician is in the best position to provide the education you need, especially in the context of your specific health issues, and to try and address any concerns or fears you have with respect to vaccine hesitancy. So we do encourage you to reach out to your family doctor if you have these concerns.
Thank you, Dr. Mirage. We'll now take questions from the media. We are pressed for time, so we will be doing 2 questions per media outlet, and I ask that you direct your question to one of the guests. So today we'll start with CBC.
Hi, good morning. I'm not too sure who could answer this actually, but just in general, how many people seem to be concerned about that mixed vaccine dose, that booster dose? And is that preventing people from getting their booster? Like, are you seeing people come in and then actually leave without getting it because they don't want to mix?
So perhaps I could offer some comments, and then my colleagues can also supplement that. I do think that for some individuals, the construct of mixing vaccines causes some angst, and they may perhaps initially want to decline getting a mixed vaccine regimen. Our message today, though, as doctors, is that that's not the best choice for your health. At this point in the pandemic, it's important to take the vaccine that is available and offered. And that vaccine is likely to provide you the best possible benefit at this time. And that's one of the reasons we're having this dialogue today, to address that concern that community members might have. Perhaps Dr. Saad or Dr. Mirage can supplement that.
Yes, thank you, Shankar. And I agree. And Jen, to answer your question, yes, we have had some patients either call ahead of time, or when they were informed that they were going to receive a Moderna booster, and when they were looking forward to something that was similar to what the original series they had. Some have canceled their appointments. Luckily, there's a lot of demand, and those spots are being filled up very quickly. We are asking people, obviously, to not cancel their appointments. It's critical that they get boosted regardless of what the dose of the booster is. We know from other vaccination series, that has been said earlier, is very safe and very effective. And also, we don't want to get into a situation where patients are showing up to the vaccine center, which again has happened, and trying to negotiate or argue with the person who's going to vaccinate them as to what dose they want to get. So that's why we're trying to educate people as much as possible in terms of what to expect when they arrive at the vaccination center. But yes, we have had some cancellations. Those spots have been filled very quickly, and we don't want people to be negotiating or arguing when they get there for their vaccine.
Okay, thank you. And do we know roughly, like, do you have a rough sense of numbers so far as to how many people have been boosted in the region?
I think Nicole is probably able to answer that question best.
I don't have the number offhand, but we will get the exact number and we'll send it out to all our media partners via email.
Okay, thanks you.
Sorry, any questions from Blackburn?
Yes, I think these are for Dr. Saad. How ready is our hospital for a crush of Omicron cases, as we're seeing perhaps the vaccine is maybe not as effective against Omicron? Are you expecting cases to rise at the hospital as a result of that?
Yes, Adele, we're always prepared for waves of patients, and as a result, just like with previous waves, we've learned from what's happening in other parts of the world and also other parts of the country, because Windsor seems to sometimes be affected in terms of healthcare crunches after other areas. We are doing what we can to ramp down elective and procedures and anything that's an emergency, particularly during the holidays, with no real plans to ramp them back up after the holidays in order to be able to accommodate a potential surge. But again, going back to prevention, although Omicron may evade the immune system if somebody has 2 doses of a vaccine, we do know that a booster and a 3rd dose in that series does offer protection against Omicron, and for the most part is offering protection against severe illness, hospitalizations, and ICU admissions. So again, the message still has to be, please get your booster, protect yourself against the pending wave of Omicron, which we know is inevitable. But we are doing what we can at the hospital to prepare in terms of creating capacity and making sure that we can staff our ICUs and our inpatient COVID units.
Okay, and thank you. And the other question I wanted to ask you is, when we finish this pandemic, when this is finally over, how important is it to have a conversation about the vulnerabilities of our healthcare system? This has been an issue for decades, and now we're in a situation where it's more crucial than ever, and we're finding staff stressed, we're finding resources pressed. How important is that conversation to take place post-pandemic?
I think it's critically important, Adele. There's no question that the pandemic has, one of the things that a big stress will put on a system is highlight its deficiencies and highlight its weaknesses. And that became very obvious during this pandemic. Human health resources was an issue. Infrastructure at our hospital was an issue. Infection prevention and control with respect to ventilation systems and HVAC systems became an issue. Isolation and private rooms became an issue. We had to physically create independent rooms in our emergency rooms and in our ICUs because they were not private rooms. So those are all need to be addressed. And then on top of that, you talk about non-COVID related issues, specifically like our surgical backlog, which was already quite substantial before the pandemic hit. And then the pandemic hits, and then all of a sudden that backlog grew even further. And how do we dig our way out of that post-pandemic? So I think there's going to be a lot of questions that come out of this pandemic, and how do we make this better? How do we prepare for a future pandemic? But also trying to patch the holes that became obvious during the course of this pandemic.
Thank you very much.
Yeah, if I could just supplement that, the public health service is one component of the overall healthcare system. I think it's apparent, and it's apparent that there has been an underinvestment in health services for a long period of time, and the goals of access, quality of care, patient satisfaction have opportunities for improvement. The pandemic has only exacerbated the struggles that we face throughout the healthcare system, and I think it's a good 2022 goal for all of us to reflect on how can we invest in health services so that we can maintain and build on a system that works for those 3 constructs of access, quality of care, patient satisfaction.
Thank you, Adele. Any questions from the Windsor Star?
Yes, good morning. This question's for you, Dr. Mirage. What are you hearing from family doctors about efforts to administer booster doses, and are they able to balance that effort with providing typical ongoing care to their patients?
So during the course of the pandemic, community family physicians have administered somewhere between 30 and 35,000 doses of vaccines in their offices. And this does not include the thousands of doses they've contributed to by working at mass vaccination clinics. Community family physicians are also contributing by working at COVID assessment centers and in the COVID wards at the hospital. And then, of course, there's the daily vaccine education and addressing vaccine hesitancy. With regard to your specific question, that's one of the biggest challenges because the opportunity cost of providing vaccines is the time spent on clinical patient care. Currently, due to pent-up pandemic demand, the demand for physician services is unprecedented. And what we find as physicians is we are often simultaneously dealing with acute, subacute, and chronic medical issues at one visit. That in addition to addressing vaccine hesitancy, and that's even before physicians get to their agenda of catching up on preventative health care. So as you can imagine, the length of a typical consult is significantly longer than it's been historically. That translates into longer wait times for physicians. So patients are waiting for longer periods to get appointments. And of course, if there is a significant loss of time due to this opportunity cost of giving vaccines, that does compound the problem. And, compounding that problem translates into increased pain and suffering for patients, delayed diagnoses, and often it can translate into additional emergency room visits. So it's a very delicate balance that we are trying to juggle.
Thank you for that, Dr. Mirage. And this is for you, Dr. Saad. We've seen of late a high number of COVID patients in area hospitals just by the numbers. What pressures has that put on Windsor Regional, and what challenges are resulting from those pressures?
At this time, we have capacity in our ICUs and capacity on our inpatient units. What we usually do during surges is we create and open a COVID dedicated unit where we have physicians, nurses, allied health, everybody working on that unit knows that it's what we call a hot unit, where either suspected or positive patients go to that unit. So we've had to open that unit up, and that has been open now for about 7 to 10 days now. We expect that to be continued through the holidays and probably into January as we try to bear the brunt of this Omicron wave. During the holidays, we would normally ramp down some of our elective procedures and surgical procedures. But as a result of what we're seeing with the pressures on the healthcare system, we are not planning to ramp back up in January as we would normally do. Again, in anticipation of some of the burden of healthcare resources and our human health resources for that matter as well. We recognize how infectious Omicron is. We recognize that we're going to have staff members, professional staff members that are likely going to be infected or come in contact with somebody who's become positive and may be out of commission and not able to work. So we're trying to mitigate those risks, again, by creating backups to backups when we did this recently this week to make sure that individual who is working at the hospital in a leadership position anyways, as well as some of our medical directors, have somebody who can back them up and somebody who can back them up as well. Again, just trying to create redundancy in the system so that we can be prepared for the worst. So we're doing everything we've done in the previous waves. I think we're being a little bit more cautious with this one because there is a lot of unknowns with what to expect with Omicron, but we've been through this before and we're going to do it again.
Thank you.
Thank you, Taylor. Any questions from AM 800?
This question is for Nicole. Nicole, just in regards to the outbreak at the Southwest Detention Center, it's up to 24 cases, but we're also hearing that there was a death associated with that outbreak. Is that accurate? Is that correct?
I cannot confirm there is a death associated with that outbreak. Rob, I can confirm that at this time.
Okay, thank you. And then switching gears, Dr. Saad, just in regards to the vaccine, and like you mentioned, how some individuals are, I guess, rejecting the booster if it's not the brand, I guess, they're looking for. Is that surprising to you, or was this expected?
I think the vast majority are willing to accept whatever vaccine they receive. I can tell you from personal experience that the patients who expressed concerns to me and contacted me directly when they learned that they were getting a different dose, I was able to offer them reassurance and give them examples from other vaccination series like hepatitis series, where the brand doesn't really matter as long as you get that third dose. And I think impressing upon them the fact that a booster is going to be critical to protect them against Omicron, and that timing is critical as well because of how quickly Omicron is spreading, that for them to wait for the vaccine of their choice, whatever that is, for 3-4 weeks is ill-advised, because by the time they get their booster and then they have full protection, which presumably happens up to 2 weeks after they receive their booster, is going to be way too late. By then, Omicron will have swept through the area, and they may not have been offered the optimal protection that they need. So yes, it's somewhat surprising, but I think the vast majority are willing to accept the guidance and the advice that they're getting from public health and from their individual clinician providers. But we still need to do more in terms of messaging to ensure that people understand that it is safe, it is effective. And in a lot of cases, we even have clinical trial evidence and studies that support mixing vaccines as offering a higher level of immunity. And we also need to get that message out there as well, that not only is it safe and effective, but it may actually offer you better protection than continuing with the same series.
Thank you.
Thank you, Rob. Any questions from CTV?
Yes, good morning. Dr. Nezasari, could you expand a little more on the advice for family gatherings, and what would be the main takeaway you would want for families heading into Christmas this weekend?
Well, the guidance is to keep family gatherings to less than 10 people indoors or 25 people outdoors. Now, recognizing it's the middle of winter or the winter season, and outdoor gatherings are probably will not be all that palatable. The reason we want to limit gatherings is to try to break the chain of transmission. And the more people that meet together, the more likely there's going to be spread of COVID. And the direction to limit family gatherings or limit social gatherings will be one part of the strategy to try to diminish the burden of COVID-19 in the community. It's important to try to break the chain of transmission, because COVID can make its way from apparently healthy people all the way to the vulnerable and the unvaccinated. And the two groups of people that we are particularly concerned about suffering the adverse consequences, severe adverse consequences of COVID, are people that are currently unvaccinated. And as Dr. Mirage had pointed out, there are about 50,000 of those individuals in the health district. The unvaccinated constitute a disproportionate number of people who are hospitalized and are in ICUs and ultimately succumb to COVID. And then the people that are chronically ill who are vaccinated, and although they're vaccinated, they're not able to mount perhaps the same level of immune response as people that are otherwise healthy. So at the end of the day, our recommendation is to limit family gatherings to less than 10 so that we can break the chain of transmission and ultimately protect members of the community that are vulnerable to suffering from COVID.
Okay, thank you. And Nicole, do you have the results from the weekend enforcement blitz, or have there been many more charges since the new restrictions have been put in place?
Thanks for asking. I did promise you that I'd give you the results today, but I don't have them. So we will commit to providing an update on the enforcement blitz that happened over the weekend, because we're working with provincial partners and all enforcement agencies across, our region. It takes, as you will probably recall, when we've done this before, it takes us a little while to compile that and put that all together. But we'll be able to provide a more fulsome update tomorrow. Again, the goal of the weekend was education, and it was actually really timely given the additional restrictions for the province that in many ways mirror the restrictions that have been put in place under the letter of instruction by by our own health unit. So lots of education, but happened certainly, and there's always There's always tickets and charges that occur. I'm not sure we do go many weekends without them, but we'll give an update tomorrow. And again, it was a good opportunity just ahead of those restrictions provincially to make sure that everybody is up to speed and doing what they need to be doing.
Great, thank you.
Thank you, Melanie. Nicole, did you want to have some closing remarks and then we'll end the media briefing?
Yeah, I just wanted to close us by, again, really just thanking Dr. Saad and Dr. Mirage for joining us this morning. And hopefully it's the first of many times they may join us to continue the conversation around vaccination and the response to COVID-19 in our community. And certainly want to thank them for their leadership and collective efforts and partnership with the health unit. So thank you very much. And I just want to remind again, everybody, once again, we know, folks are taking our message seriously. They are looking for that first opportunity to get a booster dose. Again, they can book online through the health unit website or the WeVax website for our seers. We are hoping to add additional sites in the future as we've identified. We are working on potentially a mass vaccination site in the West End as well as one in the county in Leamington. And those additional sites will be added. We just want to remind everyone, I know that the pharmacies have wait lists and individuals may be putting themselves on a wait list. Again, really heeding that advice to get the first opportunity. If you do, we just want to remind people if they do get their vaccination elsewhere to just remember to cancel your appointment, in particular with the mass vaccination site. It's very easy to do by calling our booking number or going on the website. You can quickly cancel your reservation and make sure that that spot is opened up for someone else. We are booking quickly and we are trying to add additional appointments within our region. But just a reminder that if you're lucky enough to get an opportunity sooner than your booked appointment, don't forget to cancel your appointment to allow that opportunity for somebody else. So I just want to close with that and thank everyone again.
Thank you, everyone. This will conclude our today's media briefing. We'll be back tomorrow morning. Take care.
Till then.
All right, all the best.